is definitely mayhem and outbreak in China. There are also COVID restrictions that were relaxed, and then there were widespread protests taking place across the country. People, of course, were fed up of years of those restrictions. But now with the sudden spike of positive cases that has returned, the country's medical infrastructure is facing a huge challenge. The government continues, in China as always, to hide the figures, and therefore the world does not even know right now about the scale of not only the outbreak of the cases, but if there are deaths too. Take a look at this detailed report.
Days after China withdrew its zero COVID policy, COVID mayhem wreaks havoc in the country. As China grapples with COVID mass infections, emergency wards in many of its cities and towns are getting overwhelmed. With the worsening COVID-19 situation in China, the patients are being slumped on benches in hospital corridors. Many COVID patients were seen lying on floors due to lack of hospital beds. Many worried citizens were seen walking with a homemade tarp to protect themselves. The health authorities are now predicting that the healthcare infrastructure is facing a catastrophic burden.
因为急诊没有停过，就是每一天我们从上班一直到我们下班都很忙，没有停的时候。
To make things worse, China has reduced testing and stopped reporting most mild cases. China's Zhejiang, a big industrial province near Shanghai, is battling around 1 million new daily COVID-19 infections. On Sunday, the provincial government said that the number is expected to double in the days ahead. Despite the flood of cases, deaths and mortuaries are bursting at seams. China reported no COVID deaths on the mainland for the 5 days through Saturday. As per regional officials, over 13,583 infections were being treated in the province's hospitals. But these figures are a huge deviation from a leaked government document exclusively accessed by India Today. As per the leaked document, almost 25 crore people, or 17% of the population in China, may have been infected in just 20 days after the zero COVID policy was diluted. The report also claims that nearly 3.7 crore cases were reported in a single day this week, making it the largest single-day spike ever. This report came at a time when a British-based health data firm too claimed that the infections in China are expected to be more than 1 million a day. In order to hide galloping death figures, the Chinese government changed the way it records COVID-19 fatalities, deciding only to include those who die from respiratory failure or pneumonia after testing positive. The WHO too has received no data from China on new COVID hospitalizations since Beijing eased its restrictions. Meanwhile, the Chinese health experts have recommended for the second booster shot, urging public to choose a different vaccine from the previous doses. Bureau Report, India Today.